Hello everyone. Today we will discuss about hepatitis B. In the last lecture, we have discussed hepatitis A. Myself, Dr. Asif Ali, child specialist. So, coming towards the epidemiology of hepatitis B, it's a worldwide distribution, high prevalence in Asia and Africa. Perinatal transmission most common in children. Risk of chronic infection is 90% if infected at the birth, 30 to 50% in early childhood, less than 5% in adult. So, what are the major routes? Major routes are blood, sexual, and perinatal. So, risk of chronicity depends on age and accusation. If age is less than 1 year, its chronicity is 90%. If age is 1 to 5 years, it is 30%. Breastfeeding is safe, does not increase hepatitis B virus transmission. So the clinical feature patient is suffering from hepatitis B. What happens in initial stage? Most of the patients comes asymptomatic. So many cases are the asymptomatic. What are the symptomatic illness? Similar to hepatitis A virus, but more severe skin and joint involvement. Common jaundice occurs in 25% of the cases. So when jaundice appears 8 weeks after exposure and lasts up to 4 weeks. Hepatitis B presents mainly with the extrahepatic manifestation like polyarteritis nodosa, glomerulonephritis, membranous, oblique, membranoproliferative, arthralgia, arthritis, serum sickness like syndrome, skin rashes, cryoglobulinemia. It's a rare in children. So what are the investigation? You will go for the LFTs. What you see in the LFT, increase ALT, that's most sensitive, and increase AST, increase bilirubin, and prolong PT and INR. In the serology section, you will go for the HBsAg, hepatitis B surface antigen, that is active infection, anti-HBc IgM. So hepatitis B core antigen IgM that shows acute infection. Hepatitis B E antigen that is shows active replication. Anti-HBe that is shown low infectivity. Anti-HBs that shows immunity. So the ultimate final goal is to take out the PCR. What you see in the PCR, you see viral load, treatment and monitoring. We usually do two type of PCR. One is qualitative and other is quantitative. Apart from the PCR, what are the other supportive investigation that favor the confirmation of diagnosis data ultrasound that shows hepatomegaly, chronic changes, and ultimately you can also do the liver biopsy. So these are the antigens, antibodies that are showing against hepatitis B virus. If patient is vaccinated, HBs is negative, anti-HBs is positive, anti-HBc IgM antibody is negative, anti-HBc IgG is negative, HBe antigen negative, HBV DNA is negative. Like same wise in the other that is showing acute HBV, HBS is positive, anti-HBS negative, anti-HBC IgM is positive, anti-HBC IgG is negative. Same in anti-HBeAg and HBV DNA is positive. So this is a scenario about how the patient is infected and what are the responses against the antibodies, hepatitis B virus. So here comes chronic hepatitis B. What is chronic hepatitis B? It is persistence of HBsAg hepatitis B surface antigen for more than 6 months with evidence of ongoing hepatitis. It has been categorized into three phases. The phase of chronic hepatitis B virus, number one, is immune tolerance phase. HBe-Ag is high in this phase. HBV DNA is high. ALT is normal, and liver biopsy is normal. In second phase, immune active phase, HBe antigen is positive, HBV DNA high, ALT high, and liver biopsy shows inflammation plus minus minimal fibrosis. In the third stage, that is inactive HBV carrier stage, that shows HBe antigen absent, anti-HBe positive, xenoconversion, HBV DNA less than 2000 international unit per ml, ALT is normal, liver biopsy minimal or no inflammation. So treatment, how you treat acute hepatitis B virus, that is supportive care only, rest, fluids, adequate diet, avoid hepatotoxic drugs like paracetamol, antivirals not routinely like tenofovir, anti-caver only in severe or fulminant hepatitis, monitor LFTs and PTINR. What is the clinical treatment for the chronic hepatitis B virus? So treatment is indicated in immune active phase that we have discussed. So the best responders are recently acquired infection, low HBV DNA, HBe antigen positive, ALT is greater than ULN. So what are the drugs you can prescribe? That is interferon alpha 2b, that is given subcutaneously. Duration is 24 weeks. What is the side effects? Bone marrow suppression, depression, autoimmune disorders. So lamivudine oral nucleoside analogue approved for children greater than 2 years and the duration is 52 weeks. Adifovir approved for the children greater than 12 years. The complication of hepatitis B, cirrhosis, end-stage liver disease, hepatocellular carcinoma, acute liver failure, risk increase with HDV co-infection, mortality is 30%, liver transplant only cure, and again same, the extrahepatic manifestations are membranous glomerulonephritis. How you prevent? So hepatitis B vaccination most effective, birth dose within 24 hours, routine infant immunization 0, 6, 10 and 14 weeks, HBV immunoglobulin plus vaccines to babies of HBsAg positive mothers. When a baby delivers and mother having hepatitis B, so you can give hepatitis B immunoglobulin plus vaccine. Screen blood and safe injection, health education and infection control. So if someone is infected by the hepatitis B, so this is the regime that is used. Vaccine within 12 hours of birth. Test as 9-month anti-HBs plus immune, anti-HBs and HBsAg and repeat and vaccination. So thank you very much. So this is my YouTube page, Easy Pediatrics. Like, subscribe, and share my page. Thank you.